We're going to stay in Canada, but move to the east a little bit. Our next presenter is Marie-Ève Bilodeau, who comes to us from the University of Montréal, and she's going to make a presentation on a retrospective study of cases treated with flotation therapy at the large animal clinic at the Faculté de Médecine Vétérinaire at the Université de Montréal.
Thank you, and good afternoon. So I will start by giving you just a quick overview of the Farm Animal Hospital of the University of Montreal. So it is a referral center, and around 800 to 1,000 cases are admitted each year. More than 95% of our patients are dairy cattle, and for the last 20 years, we have treated an average of 70 cases of down cow per year, but that number seems to be increasing with more than 100 cases in the last few years. And as you can see in the picture, we treat those animals by using the flotation therapy. So probably one of the most commonly used definition for down cow was the one suggested by Cox in 1981, which states that down cow is a cow that is down in sternal recumbency for more than 24 hours with no evidence of systemic illness. For the purpose of the present study, our definition will be broader and will be defined as a cow that is unable or unwilling to stand without help. We didn't use any time limit, and we have included cows with systemic illness. So as you all probably know, many primary causes can be responsible of recumbency in cows, such as metabolic condition, musculoskeletal injuries, nerve paralysis or paralysis, as well as systemic inflammatory illness. Those primary causes may or may not be recognized through physical examination and ancillary tests, and furthermore, some of them can be reversible with adequate therapy, while some others are fatal. But at the end, secondary damages caused by prolonged recumbency developed. That was clearly demonstrated by Cox and his colleagues who have shown that cows with prolonged recumbency suffer from compartmentalization and crushing syndromes, as well as extensive damages to the sciatic nerve. Other complications might also happen, so by the end, those secondary damages and complications might become more important than the primary cause, leading to a decrease of chances of recovery. So a few studies have looked at the survival rate of those dano cows, and as you can see here, with few exceptions, that survival rate seems to be somewhere between 30 to 40%. For the prognostic factors, some studies have shown that muscular enzyme AST-CK, as well as urea, might be used to predict outcome in dano cows. Many elements in the history of the cow, such as the parity, the days in milk, the duration of recumbency, as well as the importance of the secondary damages and complications, were also shown to be valuable parameters. And finally, the response to flotation therapy, as well as the quality of care provided to the cows, seem to be important for the outcome of those cows. So given all that information, the two objectives of the present study were to determine the prognosis associated with dano cows presented to the Farm Animal Hospital of the University of Montreal, and we will also want to study potential prognostic factors among the dano cow population. So we look at all medical files of cows that were treated in our hospital between March 1995 and June 2014, and we retain cows that were recumbent either at arrival or during their hospitalization. And finally, a total of 1,116 cases were included in the study. For each cow, some information related to their history, their hospitalization and treatment, as well as some serum biochemistry profile parameters were retrieved from the medical files. Statistical analysis was performed using the Z-test for descriptive statistics and the chi-square test for the univariate analysis on prognosis. A p-value inferior to 0.05 was considered significant. So for the result, first of all, the overall survival rate of our population was 51.3%. And as you can see, and of course, it has varied over the years with a minimum around 30% in 2003 to a maximum around 70% in 2007. The median number of days of hospitalization was 6 days with a range from 1 to 55 days. And the vast majority, with more than 88% of the cows included in the study, received flotation therapy. And the median number of days of flotation was 3 days with a range from 1 to 22 days. So we look at medical files. Oh, sorry. Whoops. Okay. Okay. We then try to identify from the medical file what might have been a potential cause of recumbency, and then establish the survival rate for each category and compare it to the overall survival rate. Each category was not exclusive, so a cow could have been in more than one category. So as expected, in cows with coxofemoral luxation, the survival rate was only 6.1%. Cows suffering from sciatic nerve paralysis had a significantly higher survival rate, with around 65% of those cows that survived. In cows with radial nerve paralysis, the survival rate was 56.8%, and cows with acute mastitis survive in 56.2% of the cases. Finally, cows with acute metritis survive in 68% of the cases. In those three last categories, the survival rate was not significantly different from the overall survival rate of our population. So since muscular enzymes have been shown to be good prognostic indicators in some study, we have looked at those values in our cows. So as you can see, the mean values of both CK and AST were, were significantly higher in the non-survivor group than in the group of cows that survive. So we then use those mean values, those range of values to see if it can affect the prognosis. So here you have on the x-axis the values of both enzymes. So the graph on your left is for CK and the one on your right is for AST. In the y-axis you have the number of cases for each category. In green you have the cows that survive, and in orange the cows that did not survive. So first of all, the prognosis significantly increased to 2 cows out of 3 that survive if CK value was under 10,000 and if AST value was under 500. In cows with CK values above 10,000 but under 25,000, and in cows with AST value above 500 but under 1,000, the survival rate was comparable to the overall survival rate, with around 50% of those cows that survive. And finally, the survival rate significantly decreased under 30% in the group of cows with CK values above 25,000 and in cows with AST values above 1,000. Furthermore, for each muscular enzyme, the survival rate difference between all 3 groups was significantly different. For the electrolytes, the mean values of calcium, phosphorus, and potassium of both survivors and non-survivors did not significantly differ. A significant difference in the mean of total CO2 and BHB value was observed between cows that survived and cows that did not, with a total CO2 value being lower in the cows that did not survive and BHB value being higher in that group. So in conclusion, we have shown that in a hospital setting, the survival rate for Dano cow might be higher than what was previously reported in other studies. As prognostic indicators, the values of the muscular enzyme CK and AST at arrival might be used to help in the early determination of the prognosis, reducing economical loss by producers and improving animal welfare. Finally, we are still retrieving the most recent cases of Dano cow, so it will be interesting to see if we can identify other prognostic indicators, either in the history, hematology, or serum biochemistry profile, and see in a multivariate analysis if we can predict in a more accurate way the outcome of Dano cows that are presented to our hospital. And I would like to thank the people listed here, so Dr. Gilles Fecteau, which is my residency supervisor, as well as the other clinician of the hospital, Dr. Francos, Babkin, Desrochers, and Nichols. I also want to thank Dr. Juan Carlos Arango Sabogal for the statistical analysis help, as well as the veterinary students who have retrieved all the information in the more than 1,000 cases. And I would like to thank you, and I will take your question.
Do we have any questions? I have time for in the back. Yes.
That's me? Yep. Phil Polton from Australia. I'm the author of one of those papers that you quoted, so I enjoyed your presentation. Thank you.
Thank you.
My specific question on the CK, Clark's work has a time-adjusted threshold that he uses to predict his probability of survival, because the short half-life of CK means the value that he has is critical varies dramatically from day to day. Your figures were just a base number. I assume you didn't use any time adjustment on that, and if not, could you comment on that, please?
No, we didn't adjust nothing. We took the first value, so either at arrival, but no later than 24 hours after arrival. So yeah, that might be, because some of those cows have been down for 1 day, some of those other cows are down for 3 to 4 days, so it could have an impact, but we haven't.
Yeah. That's right, because Clark's threshold, I think after 24 hours of recumbency, is about 50 times the upper limit, and down by day 7 it's down to something like about 11 times or something. There's a dramatic difference from day to day. But,
we look at, I just look at it before coming here, but we have saved like cows with CK values above 8,000, 80,000, so yeah. Yeah,
I found with my work, I blood tested all my Downer cows, and a number of cows had CKs very high, but if they provide good quality nursing, a lot of that will recover. And in the flotation tank, that would be excellent nursing to stop a lot of that ongoing muscle damage. So, thank you.
Thank you.
Quick question, Walter.
Walter Grumer, Hannover. One question, I saw that you put 88% of your down cows in the flotation tank. I was just curious, what is the criterion to put her or not to put them in the flotation tank in Montreal?
For example, if we diagnose coxofemoral luxation, then we don't put them in the tank. Some of the, like for example, cows with acute mastitis or metritis sometimes are too ill to go in the tank for the first or 2 days, and then maybe they have died before we have time to put them in the tank. So.
Okay, thank you very much.
Thank you.